I'm Alexa Barach. I'm a Clinical Case Manager at the O'Connor Professional Group. I do case management, therapeutic coaching, and I do some specialty projects as well. The clients that I typically work with have mental health diagnoses of anxiety, depression. I also work with eating disorders and some substance use as well. I've been working in the clinical world for about 4 years now, and I'm a social worker. I found the O'Connor Professional Group at a career fair. It sort of encompassed all the things I thought I wanted in a clinical job. It's a dynamic group of people. We have PhDs, we have social workers, we have other licensed mental health clinicians. We also have individuals that just have life experience working in this world. Either they've been affected themselves or family members. So it's a wonderful group of people that understands and really gets the needs of our clients that we work with. So I worked with a client named Jane. She's a 20-year-old female, originally from California, living in the Boston area at a major four-year university. She's a junior in college right now, and her primary diagnoses are anorexia nervosa. She has a nonverbal learning disability, so she struggles with executive functioning, and she's been increasingly anxious. Her parents are divorced, and they have an amicable relationship, but her father is mostly absent, and her mother is a little overbearing, come to find out, and controls a lot of the behaviors that Jane has in her activity at school. Have been working with her twice a week, doing primarily executive functioning and meal support services. So I would meet with her because she was struggling with her eating disorder, which was still pretty active at the time. I would sit with her for lunch, for dinner sometimes, and help her through the meal. It's also suspected that she has ADHD, so we've worked with an educational consultant to get some neuropsychological testing done just to be sure that the school has the resources they need. Jane's neurocognitive profile shows that she has a very high IQ, but has difficulty processing information. So when she is listening in a classroom or taking notes, the information goes in, but doesn't really stick anywhere. So it's difficult for her to then internalize and use the information that she learns. Jane still hasn't nailed down what her learning style is, so college has been difficult. During the consultation, our initial recommendation was for her to go to a higher level of care, for her to seek an inpatient residential treatment because of her active eating disorder. The parents were not comfortable, they weren't ready for that yet, and through family coaching, the family coach has really been able to encourage and support the parents through their realization that their daughter needs a higher level of care. So right now, she is in residential treatment for the treatment of her eating disorder, and I've been in contact with the providers to make sure that I'm there and available during the transition once she gets back into the community and back to college. As a young social worker, I was really drawn to this group and the O'Connor Professional Group over some of the other ones because we really have the ability to affect great change in our clients. A lot of the clients and the families that I work with and that I've seen my colleagues work with have similar stories to the families that lived down the street from me growing up. It's amazing that I've been able to find a group of people that are like-minded and are dynamic and want to challenge one another to serve our families as best as we can. It feels a little like a family working together. We are the backbone of a lot of these families that just don't know what to do and don't know where to go. I love that I can make an impact.